Hello, welcome to class. We're going to be working on Chapter 15 today, Analgesics and Antipyretics. These are our learning objectives. We're going to be able to define analgesic, anti-inflammatory, and antipyretic medications, identify analgesics that are regulated by the Controlled Substances Act of 1970, describe therapeutic effects of narcotic and non-narcotic pain relievers, non-steroidal anti-inflammatory drugs, also known as NSAIDs, and antipyretics commonly used in ambulatory medical care. We'll be able to classify non-opioid analgesics and antipyretics commonly used in two categories according to their use. Provide patient education for safe administration of non-prescription analgesics and antipyretics, also known as over-the-counter medications, OTC. Educating the patient about drug safety by making them aware of the dangers of the over-the-counter and prescription analgesics, and providing the patient with education for compliance with medication used as analgesics and antipyretics. So let's talk about pain. What is pain? So pain is a perception. So we have an awareness of a painful stimulus. Then a pain threshold acknowledges the stimulus is painful, and we all have different pain thresholds and pain tolerances. And the tolerance is the ability to tolerate the pain. So what other factors affect an individual's psychological or emotional response to pain? What do you think that is? Mental conditions, physical, stamina, ethnic background, and many other things. So we also need to realize that naturally released endorphins block painful impulses to the brain. So that's why sometimes when we are we have a lot of those endorphins going and we're really moving and we're not thinking yet, we don't notice the pain as much as we start to calm down. So pain and emotional responses, signs and symptoms. Contorted facial expressions can show pain, changes in posture, increased vital signs. So if you're taking a vital and they're higher than normal, that definitely can be related to pain. Grasping or holding a body part, or like we talked about in a class session a couple weeks ago, guarding a body part. If they're restless or lethargic, and lacking focus or focused on themselves, and if they're showing fatigue. These are all pain and emotional, these are all emotional responses to pain. So pain in relation to medications. We're talking about analgesics, and analgesics relieve pain, and antipyretics reduce fever. Anti-inflammatory reduces inflammation. So these medications all do different things. Analgesic, again, relieves pain. Antipyretic reduces fever. And anti-inflammatories reduce the inflammation. Many medications accomplish all three. For example, it gives an example of aspirin. So what is acute chronic pain? Acute warns of tissue damage, and usually it's short in duration, whereas chronic does not have the sole purpose of indicating tissue damage, and usually chronic is longer in duration. There are different types of analgesics. So we have opioid, which is a narcotic containing opium. So for example, morphine. There's non-opioid, which does not contain opium. And there's co-analgesia, which is two medications used together for synergistic effects. So co meaning two. And adjuvant, used to increase or hasten action of principal medication. So it's used with another. Uses of opioids and opiates, analgesic ladder. So we're looking at this from mild pain to severe pain, and then we see the different types of medications that can be used for those. So how do you think opioid or opiate analgesics work to relieve pain? They actually alter the perception of pain by mimicking the endorphins to block the neurotransmission. So there are some side effects when we're talking about the opioid and opiate analgesics. They might have lightheadedness, dizziness, orthostatic hypotension, drowsiness, constipation, diarrhea, headaches, nausea and vomiting, and even sedation where they're not responding well. What are some additional side effects that you think narcotic analgesics could have? To see this, look at your table 15.1 and you'll find even more side effects. So there are some precautions as well with opioid and opiate analgesics. So we can see confusion and respiratory depression. We also need to check for liver and kidney impairment. Constipation is often a side effect. A cough reflex is suppressed. So sometimes when they need to be coughing and then that reflex is suppressed, that can cause problems. And men with benign prostatic hypertrophy should be educated about urinary side effects when using the opioid or opiate analgesic precautions. There's a transdermal fentanyl, and it's important to know these things. It's used for chronic persistent pain. Remember, we said chronic is something that usually lasts longer. So it gives an example of cancer in patients. 72-hour continuous opioid administration. So that means it is going transdermal into the skin, and it is good for the 72 hours. You have to make sure that you clean the skin with a water base and water before administration, and you avoid heat sources, soap, oil, lotion, and alcohol, because they can actually alter the absorption of this medication. Is fever considered a heat source for the counterindication of transdermal fentanyl? What do you think? The answer is yes. It increases the absorption rate by about 1/3, which is interesting because it shows that even something that the body is doing natural can affect absorption rate. Okay, so non-opioid analgesics. They're used to control mild to moderate pain, greatest actions on peripheral nervous system, no physical dependency or tolerance, no altered consciousness or mental function when using, and a ceiling effect can occur. So what is a ceiling effect? A ceiling effect, the side effects of increased occurrence and intensity if the dose is increased without providing increased relief. And you can read about that more in your text. So as always, as we're looking in both classes, the pharmacology and our clinical medical assisting class, we always have to look at patient education. So this is patient education for compliance. Patients allergic to one analgesic might also be allergic to another, so it's important to be aware of that. It's important also that the patient contact the physician if pain persists and they're not seeing any relief with the medication. So it's also when they're getting their medications, it's important to know if they take with their meals or without their meals, and that they can take with meals if the stomach is in distress or it causes discomfort in the stomach. Analgesics can be contraindicated for patients with kidney and liver disease or pregnant or breastfeeding patients. It's very important to know that. Children with viral infections, okay? So a child with a viral infection should not have aspirin, as well as if you are going to have a surgery, you need to stop that aspirin use at least 5 days before surgery. Why do you think it's important to stop taking that aspirin? You're right, it slows blood clotting by preventing. So you need to make sure that if you are having any kind of surgery that you stop, or the patient knows that they need to stop at least 5 days prior. Do not place aspirin on gums, teeth, or mucous membranes. Do not take aspirin with strong vinegar odors. Drugs may cause drowsiness and will reduce coordination. It's important for them to understand that, especially if they're working or have other duties that they need to perform. And it's also important that they do not exceed the recommended daily dose. So here's a little bit more on the patient education for compliance. Acetaminophen may cause a false positive decrease in blood glucose levels on a home testing strip. So, for example, if a patient is going to be testing their levels, say they have diabetes or something, it's important for them to know that the acetaminophen could interfere with that reading, and it can cause that false positive. Acetaminophen combined with alcohol intake increases the risk of liver damage. So that's another important detail for a patient to know if they're taking acetaminophen. And aspirin and ibuprofen should not be taken together. Why do you think aspirin and ibuprofen should not be taken together? It's because the two medications slow actions of each other and increase side effects. Okay, and the side effects could be GI bleeding, decreased effect of aspirin. However, if low doses of aspirin are prescribed to decrease the platelet aggregation, then the aspirin ibuprofen can be used. So combining analgesics for greater effectiveness. We do this to relieve moderate or severe pain. Narcotic and non-narcotics can be combined. Drug names ending in the CET contain acetaminophen, and drug names ending in the DAN contain aspirin. Why are narcotic and non-narcotic medications often combined? Why do you think that happens? That's right, the non-narcotic agent provides a foundation for the analgesic relief, which then allows the narcotics to be more effective. And finally, analgesics in children and elderly. We know that there are definitely differences in special populations. So in children and elderly, need to be used with caution. Poisoning can result from inappropriate use. Do not give children with a viral infection aspirin. It can contribute to the Reye syndrome. So we talked about that earlier in this lecture. That's something very important to remember, that if a child has a viral infection, that they should not be taking aspirin. Okay? Do not ever call any medicine candy. Why do you think we wouldn't call medicine candy? Right, because if a child thinks that the medication is candy and they know already that they like candy, just like I like candy a lot, then they might seek out to find the medication and eat it as candy, which could cause a lot of problems. And then elderly patients are more prone to gastric irritation and constipation, and opioids have higher peak values and longer duration of action in this population. Okay. All right. Thank you very much. I hope that you have learned a lot about Chapter 15 and about our analgesics and antipyretics. And also, we talked a little bit about anti-inflammatories. We will see you later in class. Have a great day. Bye.